For the third annual World Coma Day, I'm proud to introduce our neurocritical care team. Our mission is to reduce prevalence and severity of disorders of consciousness through research, education, and excellence in patient care. Here at Keck USC Neuroscience ICU, we are curing coma. We love curing coma.
A coma is a state of unconsciousness for a prolonged period of time.
Coma is a state of unconsciousness that can be caused by an illness or an injury to the brain.
Coma means being unconscious and not being able to breathe on your own.
Coma is most often caused by neurologic or a metabolic injury to the brain, but coma can actually also be induced by the ICU medical team to reduce the amount that the brain needs and reduce the stress and actually help them heal.
Here at Keck, we love to cure coma by addressing our 8th RUF bundle with our interdisciplinary team to make sure that we address all of our patient-centered needs.
We use these wedges to turn our patients every 2 hours to prevent pressure injury.
We use multipodous boots for our patients to prevent foot drop.
And we also assess pain assessment every hour to make sure our patients are comfortable.
Comatose patients, it's important to provide adequate sedation and comfort. Here at Keck, we use RASS and CPOT scores to evaluate our patients' sedation and comfort levels.
Nurses implement many standardized procedures such as initiation of sepsis protocol, hypoglycemia management, declawing central line access, treatment of extravasation of IV medications, and seed of testings that allows us to independently perform functions to ensure timely and safe interventions on our comatose patients.
We use state-of-the-art diagnostic equipment such as CT scanners, MRI, electromyography, also known as EMG, and continuous EEG to help manage critically ill and comatose patients. We also provide 24/7 hour coverage with neurointensivists, neurointerventionalists, and neurosurgeons.
If a patient is in coma, they may be unable to safely breathe on their own. In those cases, we may need to place a breathing tube during a process called intubation and use a mechanical ventilator for respiratory support. If patients are in a coma due to bleeding or high pressure in the brain, they may require surgery or a bedside procedure. A drain like a subdural drain or an EVD can be placed to relieve intracranial pressure and help drain blood. An EVD, or an extraventricular drain, is a catheter which is placed in one of the lateral ventricles in the brain and serves to remove CSF and can prevent complications like hydrocephalus. If someone has seizures, this can also lead to coma. Seizures are not always visible to the naked eye, and so sometimes we must do continuous EEG video monitoring to detect seizures. We have many medications available, as well as other interventions like ketogenic diet to help treat seizures.
Clinical pharmacists help manage the recovery of patients with coma through drug therapy optimization. We review medication regimens on a daily basis to help identify any therapeutic duplications, any errors in medication ordering, or any potential drug-drug interactions.
In collaboration with occupational therapists, physical therapists apply multimodal stimulation to help improve wakefulness in patients with coma. This could include having music in the room, or helping patients get to the edge of the bed, or even providing some type of touch stimulation or sensory stimulation to help improve a patient's wakefulness and arousal.
OTs help prevent loss in range of motion and help maintain skin integrity. Crucially, occupational therapists help find ways for families to interact with their loved ones while they're recovering from coma and vice versa.
Dietitians play an important role in the recovery from coma. Oftentimes, our patients require nutrition support in the form of tube feeding, and we're also very crucial in that we help transition them from tube feeding to an oral diet when the patient is ready. This, of course, puts the patient at risk for malnutrition, so it's our job to identify and prevent it from happening. Our work aids in preserving skin integrity and lean muscle mass.
We love curing coma because we want our patients to be themselves again.
We're curing coma! We love curing coma because we love to see patients and their family reunited.
We're curing coma! We love curing coma because we want our patients to breathe on their own again and be reunited with their families.
We're curing coma!
We love curing coma because we love it when our patients get back to doing the things they love, which give them meaning in life.
We're curing coma!
We love curing coma because we can bring patients back to their family, friends, and community.
We're curing coma!
We love curing coma because as nurses, we want to make sure that your loved ones make it home safely.
We love curing coma!
We love curing coma because we want to see our patients have a meaningful recovery and an improvement in quality of life after brain injury.
We're curing coma!
We love curing coma because nothing is impossible.
We're curing coma!